video series at Teeth Neurology. How do you tell the difference between a seizure and a syncope? A seizure is, of course, electrical discharge in the brain, and a syncope is where you have loss of consciousness arising because of drop of blood pressure, and it occurs because from a cardiac reason. So syncope is usually evaluated by a cardiologist, where seizure is evaluated by a neurologist. Both of them cause loss of consciousness. So often I am in clinical practice have a situation where I have to distinguish between a syncope and a seizure. So how do I tell the difference? Seizures are associated with prolonged loss of consciousness. Typically, you can bite your tongue, especially a side tongue bite. You can have incontinence of urine, though that can also happen in syncope. And after the seizure occurs, you can be drowsy and confused for a long while. And seizures can occur in any position, standing, sitting, lying down, often occur during sleep. On the other hand, syncope is usually it's very brief typically. It's a brief loss of consciousness, almost always occurring sitting or standing. The person's blood pressure and pulse drop. So that can be useful if someone has recorded the blood pressure at the time of the blackout and it's very low, then it is a syncope. The pulse rate can also drop, though the pulse rate can drop in a seizure, though it's more likely to go up. And then the person becomes very pale, they can become sweaty, and there's very rarely prolonged period of unresponsiveness or rather confusion after they wake up. If there is prolonged confusion, it's because they hit their head when they fell. So those are some of the ways to tell between a syncope and a seizure.